Westbrook, the St. Louis County Public Health Division Director. And this was published in the Mesabi Tribune yesterday. And then I was able to get a copy of it from the county. And so if you'd kind of turn past the agenda, and I just want to highlight a few points on that. So you can also link to that later, but I'd encourage you all to read that. Amy Westbrook is our St. Louis County Public Health Division Director. She works closely with Aubrie Hoover. And thank you, Aubrie, for providing this copy of it so we could have this and the link. But some things to look at, and she kind of an overview of the pandemic. Area hospitals, if you look at the bullets, area hospitals have been at capacity for weeks and have had to divert patients. I can tell you I've had a personal experience with that, having to go to a funeral of somebody who could not get transferred to somewhere else, and that was just this week. But other healthcare professionals are talking about that too. Schools and long-term care facilities are dealing with outbreaks and having quarantine, tested for COVID-19 in the list than last year at this time. And again, to highlight that, even with 120,000 of 200,000 residents in St. Louis County, more people are getting sick now than a year ago at this time, even though we've had all those vaccinations. So, and more people are dying. So, near the bottom of the page, strongly encourage layered disease prevention approaches and pleading with people to get vaccinated. So please take the time to take a look at that. Again, that's from our public health director in St. Louis County. And then I'm going to, you should have the data in front of you too from St. Louis County. And if Aubrie Hoover could you can certainly highlight anything you want to on your
Now for Northern St. Louis County, we're looking at what was posted today, 67.5. And then early projections for next week are bringing us up to 80.5. And that's for a period of 9/12 to 9/25. When we look at those cases and where those cases are coming from, I also provided the schools with kind of a breakdown of geographical areas and the age ranges. We are seeing 29.2% of those cases come from 19 and younger. Steadily been going up for the past several weeks. What I am seeing in schools that have that layered mitigation approach is there are less cases transmission within a adopting a minimal mitigation strategies, such as they might send out an exposure, sending kids who test positive out for isolation. We are seeing cases just spread like wildfire within the school, and then they are now, instead of coming from home with positive COVID and being in school while infectious, they are taking it from school and bringing it home. And I'll pause there for questions.
Any questions from council members? I know that Aubrie has been consulted this week too by our principals as we deal with any of our positive cases. Also, as we look at we've been kind of reviewing our quarantine measures because we've had some questions on that since we put out our revised plan. And So the next piece of data we have there is our local zip code case rate. It did go up from 17.72 to 22.55. We now have 2 cases in our school. We've had a total of three cases for the entire year right now. But again, if you read our local, if you read the media, the statewide media too, you'll notice that the death rates have gone up. Deaths in St. Louis County, I think there were, I don't have the previous week, I think it was 4 more, so 342. We're at 8,153 in Minnesota and 691,517. And to put that in context, that was fortunately is that it appears that that'll be more people than died in the Civil War, which claimed more lives than any other. So it's unfortunately it's still with us. We're still dealing with it, and now we're looking at strategies to see how do we manage this and what part do masks and other things play in masks, vaccinations, and other things play in dealing with the pandemic. So what I'd like to do next, before we get to the metrics too, is just report out from some of our other advisory council members. And at Essentia, is there anything that you would like to report out at this time?
This is Heather. I would just say that we continue to test, and we vaccinated approximately 100 people today. A lot of that was third boosters, but we are seeing definitely those positives coming back as well.
Okay. 100 vaccinations today. That's great news. Okay. One of the things I'll put out some messaging, but I've been making some phone calls and talking to some of our local institutions, and Essentia being one of them. And Heather, it kind of puts you on this, I might be putting you on the spot a little bit, but this is a question that I asked of one of the doctors up there too. Does Essentia have, you are in a mask mandate for your employees at this time, correct?
Correct, we are.
Do you have any metrics or any thresholds that you're looking at for when you might dial that back?
Not that I know of at this time. I have not been told anything.
Okay. All right. Thank you, Heather.
This is Sandy in the clinic too. I just wanted to say though, we because we're all vaccinated, we are able to. There are times when we can be unmasked when together, like for meetings and such, because we are all vaccinated. So that's a big determining factor.
Yeah, that certainly would make it. Excellent. Thank you. How about over at the hospital? Tiffany, are you available? Tiffany, I know Patty couldn't be here today, but I'll be checking in with them too. Anybody from Ely Bloomington Community Hospital? Okay, if they loop in later, we'll try to pick up with them. But I'm going to be asking them the same question, as an institution that I believe is, has a mask mandate. How are they handling that, and what are they looking at also for metrics and coming back to being without masks? Betty, could you report out, please? Nurse Betty Erickson? or Mary?
Hello. Can you
Hi.
hear me now?
Yes.
Okay. Anne's going to report on a lot of it, but I just want to tell you we've been testing using the Q test, and it's working well. And also we've handed out some of the Bionac now kits to people at home that have symptoms. And that's going well also, and people seem to be receptive to that. And then I'll leave the rest to Anne.
Okay, Ann, I guess you're up.
Well, we sent out all of the consent information. We have a consent form, and then Aubrie also helped with some of the privacy practices information. And so we got that sent out to all K-12 families. So if families ever want us to test using that Q test at the school, we can. So we actually have done some today too on students. We've tested it a couple times on adults, so we feel pretty good about that. And that's pretty exciting because we want to keep the kids in school as much as possible. And so if we can test at school as much as possible and keep them here, then that's great. So we're working through those kinks, and that's a positive for us to keep in-person learning going.
Okay, thank you, Principal Oelke.
Mm-hmm.
Principal Anderson, is there anything you would like to add? No? Okay.
She had to step out.
Yep. Okay. Activities Director Tom Coombe.
Yeah, Eric, as you're well aware, yesterday we had a report of an exposure in our volleyball program. Last night, notification letters went out, as well as an offer to have volleyball players come in and get tested. So that notification went out. The exposure, from my understanding, the person who tested positive was not symptomatic, but at practice earlier in the week, a game on Tuesday night, and has not been with the program since.
Say, Tom, you and I talked yesterday that the high school league had come out with some guidance at the end of last week. Could you please highlight what that might be and how participants might be treated if they do test positive?
It's almost identical to our safe learning plan. The language is, nearly 100% identical. If a participant or a coach tests positive, they must be out for at least 10 days. They must be symptom-free before they're able to return. So that is a requirement now from the State High School League regarding a positive test. That participant must be isolated, sidelined from the team for a minimum of 10 days and be symptom-free when they return. There's also a recommendation that those close contacts be, it's recommended, not required, that those close contacts test, and they recommend that the test come 3 to 5 days after the exposure. So, say somebody was a close contact with this person who tested positive, and they're with this person on Tuesday. The State High School League recommendation says wait, until day 3, day 4, day 5 to take the test. And my understanding that's pretty similar to what's in the plan for the student body as a whole.
Say, Tom, and some of that, we talked a little bit about close contacts. We kind of defined that a little bit tighter in our revised plan. But if we were to have people that were exposed to positive people, they were a close contact, one person's vaccinated and the other one isn't vaccinated, and they're on the team, how are those two treated?
A vaccinated person, and again, kind of mirrors our plan. A vaccinated person would not be required to quarantine. They would, unless they got sick themselves and began to show symptoms. So they're, that's the, we talked about this, all the way back last spring with our athletes. And Eric, you remember you talked to several of our teams. That's a that's a bonus for students who are vaccinated. Should they become a close contact with someone who is COVID positive, if they are fully vaccinated, the necessary time has passed from their second shot, they can continue on as is and continue to participate. Where someone who is not vaccinated may not have that same ability.
Okay. All right. And just in general, we've had pretty good compliance when we've had home events with the masks that I've seen. Have you had difficulty with spectators coming in?
We've had 2 events so far, and from my understanding, there haven't been many complaints or real difficulties with our game staff.
Okay. All right. Thank you, Tom.
Sure.
Parents, I know there are a number of parents out there too, and Melissa Hart, who usually joins us, could not be here this afternoon. We have a number of people on the advisory council, certainly that are parents, and one of them sitting here in our room, Mr. Leeson. But also our principals get feedback from the parents, and I know the one thing that we've had some feedback on is interpreting the guidance on quarantine. And I encourage people to call the school nurses too, because once you look at the how you might interpret whether it's an exposure or close contact, I think it's helpful if you're able to walk through that with one of our nurses so they can help determine what the quarantine, what might apply from our revised safe learning plan, or go through it with the principals. Is there anything that either Betty or Principal Oelke you'd like to say about the quarantining piece? Is that okay?
No.
Okay. And I've discussed this with, go ahead. Okay. Again, but I encourage people to check with our school nurses too. Then is our student Bryce Fairchild on right now? I know I talked to Principal Anderson, and she was trying to get Bryce here today. Bryce, are you there? Apparently not right now. So let's go to Jason Kelly from Ask Me. Anything for us this afternoon? Okay. All right. And from the Erie Education Association, is there anybody out there from the education, representing the Education Association? Okay. And as we get into the metrics too, we can hear from other people too. From Tom Omerza, are you there?
Huh.
Tom Omerza from our school board? Not right now? Okay. All right, so we're going to go on to the next part of our agenda is the metrics for return to less restrictive mitigation. Relaxing the face coverings. On the agenda, I just left on a few of the key points that led us to where we're at right now. Again, in talking with the principals and looking at the increase in the case rates, local zip code, and our biweekly case rates, we don't anticipate dialing back within the next 2 weeks. But we certainly have been hearing that people would like to know what are some of those markers you're going to use in looking at dialing back. So if you go to the next document, It has some of the notes from last week that we had talked about possibilities or thoughts on metrics. And, we look at the biweekly rate for Northern St. Louis County, a certain rate for usually when we did this last year for a few consecutive weeks. Aubrie from St. Louis County Public Health, what do you feel comfortable in sharing about what some of the other schools, not naming them necessarily, but what are some of the other markers that schools are looking at that you know of?
Well, I believe there were some that were highlighted in one of your local newspapers, but so those are still the same and those haven't changed. But then there was a new one that was adopted just recently where the school passed the vote that if the biweekly rates for their region goes under 30, then they would release the mandate and go back to strongly recommended, but also retain and hold on to the option to mask a grade or a cohort for 2 weeks if they're experiencing increased cases within that group.
Okay. Within group. Okay.
And I did speak with one of our regional epidemiologists from MDH and just kind of talking through that biweekly rate again. She was kind of leaning towards there's nothing out there in the guidance, but looking at what we saw last year and when we saw it kind of going into the school, she again kind of came back to that 25 and that 30 range.
Okay. Okay.
Aubrie, I have a question. Is that just right when it hits 30 they move, or hits 30 for a period of time, or what was it?
For the school, it was for 2 data points, so they can see that it's maybe trending downwards. So it's not 1 week we're under 30 and the masks are off, and then next week it's above 30, so we're doing masks on again. So really looking for the 2 data points.
So like two consecutive weeks, kind of?
Yeah.
Okay. Okay, just
Okay.
wondering.
Aubrie, is anybody predicting right now? We know we're going up next week. I mean, that's projected. But is that in your crystal ball? Is that, is that our peak?
I spoke again. We had a big meeting with our MDH team, and for our regional epidemiologist, what she is seeing as far as cases is that we're not seeing a peak within the next 2 weeks. One of our regional county is actually a neighboring county, Kuchaching. They are already at a higher rate than they were last year. So that they ever hit last year. So we will go up, and based on the cases that I'm working on this week right now, we're going to go up again above, especially in central and northern St. Louis County.
Okay. Well, how about vaccinations for either either for our the under 12 years old and where we might be at with that, and also with our population that's at 41% here, with the 12 to 18 year olds, should we be running another pop-up vaccination clinic, or can they get this done at Essentia like Heather said, they vaccinated 100 people today?
Well, to my understanding, the clinic and the hospital has already offered to come to the school and do a vaccination clinic for the 12 to 18 population. I think they're just waiting for
we are happy to come at any time. We just name it.
Mm-hmm.
Oh, that might be a great homecoming event.
I think we prefer to get a date from you rather than pick a date on our end. If we could get a date that you guys are interested in, then we can easily staff that rather than doing it the other way around.
Okay, the administration team will take a look at that and see, what we can do there too. Thank you.
And what we're hearing right now is that we're kind of anticipating the 5 to 11 group and approval. as early as like early November. So people are saying between November and Christmas, but as early as November approval. And I don't know if the healthcare systems are planning on doing another vaccine clinic for the 5 to 11. If that's something that you're looking into or planning for, because I know we're starting to make our plans and how we would work with community partners to get that done as quickly and efficiently as possible.
So I already filled out the MDE survey for the 511 clinic, expressing that we would host one for our school if they want to. I also know, though, that the clinic and hospital would be super supportive as well. So I already put the ball in motion on that one.
Yeah.
That was a weird quote. Sorry.
Thank you. Okay. So we'll look at those vaccinations too, because that's one of the markers I had mentioned last week too, where we were at 41%. So our glass is 41% full. We'd like to get it up over 50 at 51% or better, ideally. I have been, and we kind of looked at some other things too, vaccination rates. Has that gone up in the county, Aubrie?
Again, it's just moving like centimeters at this point. The first dose went up by 1%, and the second dose, or the completed, has stayed the same. So by 1%.
Okay. Also, kind of looking at some of those other schools, we have some schools, other schools certainly that are masking. We have other institutions that I talked about. But are some of those also looking at treating the elementary different than the high school? Like I know I talked to two harbors, and they are masking in the elementary, but not in the high school at this time.
I would say that most of the schools that have moved after school started are universal masking right now, especially as we surge, but that's something that they are looking at when they kind of dial back down if they're going to do a two-tiered approach. But right now, most are universal.
Okay. All right. So that's one of our questions. Should the elementary metrics be different than the high school? Are there thoughts on that?
This is Heather. I think that I think that the elementary, until there's the option to vaccinate, should be treated differently than the high school.
Okay. Because right now we have 41% of our high school, and we have 0 of our elementary, as far as we know. So we could look at that too.
That includes staff as well. If you're separated by the buildings, would staff in the elementary be required if the students are, or would that be different?
Required? What do you mean? Here,
So
Jason.
if you require masks in the elementary because they're not vaccinated, but not in the high school, does that include staff?
We're not saying that, though, Jason. We're saying a mask requirement is regardless of vaccination status at this point.
Correct, but if you do a two-tiered approach where at some point you dial back the high school for the students because 51% say are vaccinated, then would the staff not be required to wear a mask if the students are not required? Whereas the elementary, if nobody's vaccinated there and you do a two-tiered approach and the students in the elementary are required to wear a mask, would the staff be included with that decision as well?
Well, I would think so, but that's just me. That's just my opinion.
I think you have to wait because you got a head start in this building.
Oh, yeah.
If we wouldn't be able to.
Yeah, Mr. Leeson made a good point. We have Head Start that's, hopefully next year we'll be in a different building, but right now they're in the Memorial Building too. So good point. So good question that I think we need to take a look at too, and people will want to know. Right.
Mm-hmm.
So, Other things to consider. There might be some things down that we haven't thrown out here.
I'm just trying to, so I've been reaching out to my principals associations in all the schools, just asking it seems like nobody's really saying what is their actual solid plan for dialing back. No one's really committing to put that out there quite yet. I'm trying to find out more. Yeah, so I'm trying. I also emailed Vermillion as well this week asking what is theirs, because I know that came up at the board meeting.
Yeah.
I'm trying to find, beg, borrow, steal anything that I can. That makes sense for sure.
So I've been telephone tagging with our local provost, with Chris Hoivisto, and he did call me back. I just wasn't able to take the call, so I hope to find out from him this afternoon. And again, I'll try to hope to find out, or at least get answers on some of the other local, like Vermillion Community College, Essentia, like Heather, we talked about. We don't know yet. The hospital, St. Louis County, I talked to the county commissioner the other day and asked him if he knew if county offices were relaxing their mandate or what it would take to relax, and he was not sure if there was anything out there at this time. And again, we have another office, the Department of Revenue, the Erie office, and seeing what, if they've gotten some guidance and direction. So we're going to continue to look at those institutions too. But we have a pretty vulnerable population right now that we're dealing with the elementary. Other thoughts on what we might look at, other markers?
Is there a number that the St. Louis County Public Health or any of our health professionals for a biweekly case rate would suggest? Has Dr. Bianco or anybody suggested numbers and why those numbers would be helpful? I hear suggested here the Northern St. Louis County case rate under 20 for 2 consecutive weeks. Who threw out that number and why?
That was me, Jason, and partly that was kind of looking at where we have been at. And one of the things, if you look on your agenda, that biweekly case rate in July, when we thought things were going to be a relatively normal start to the school year, we knew Delta was out there, we were at 1.24. And we were kind of sailing along, and then things changed significantly. So that's kind of where that came from. Also, it kind of came from the metrics used last year from the department, from the Minnesota Department of Education.
I'm just wondering if Aubrie, or if you've suggested that to Dr. Bianco, if he supports that number. I mean, it seems like a good number to start with, but I don't have a clue.
Right.
So CDC actually put like the recommendation for, they didn't put a time on that. They didn't put a threshold. They didn't develop any of that guidance. It was just recommended that schools mask regardless of vaccination status for this year. So there was no threshold created. So MDH didn't adopt a threshold either. But in talks with like my regional MDH epidemiologist with what we were seeing in the schools last year, felt like really a conversation around a school that wanted to set their biweekly rate at 50, and we wanted to give them maybe a place to come down from that would be reasonable to keep kids and families and faculty safe. And we kind of said that 25 marker.
Now, I'll tell you, the other reason I threw out that number 20 is if you go to the data from our Northern St. Louis County and you look at our case rates, and I've gone back there. So if you go back 1, 2, 3, 4, 5 weeks. So 5 weeks ago, when we weren't going to mask, we were under 20. We were at 19.2. So that's another reason I kind of threw that again out there too, because at that time hadn't started, but we still knew, and some people had already put out their strategies for opening, school, but we were under 20 at that time, and we weren't going to go masking. So to me, that kind of made sense to, go back to where you started.
I wonder if there's any science associated with that.
Any science associated with that number, Aubrie? Well, lots of science, probably.
Yeah, there's actually 2 studies, with that number. No, there's some recent studies about how masks are effective in school as one of the mitigation layers and helping schools that have the mask requirement to keep outbreaks at bay. Science behind that number, there's nothing, no science around that. No one's kind of studied that. Right now, the recommendation from CDC and MDH is to wear masks throughout the year, with adopting possibly that exception to close contacts, where if both the positive case and the close contacts are wearing a well-fitted mask consistently, then you're going to have that ability to keep those close contacts in school instead of sending them home, unless they develop signs and symptoms. Also, if they're vaccinated. So
what I'm hearing is that we're just kind of on our own, coming up with our own numbers without any significant recommendations or scientific backing for those numbers. We could pick a number and then implement that and take our masks off and everybody gets sick maybe, or not. So what I'm hearing is that it's not, it may not be feasible to, or you're obviously not recommending that we have a mitigation, that we have this. Is that correct?
that's the recommendation from the CDC and MDH. And then we fall under MDH as local public health and kind of sharing their best practices. Now, schools that want to dial in with a threshold, I've tried to help them the best I can, get some answers so that they can do so. And guidance might change once the vaccine's eligible for our 5 to 11-year-olds. We might see you can dial back at this point for implementation purposes of best practices. But I don't anticipate any guidance like that coming until that vaccine is eligible for our elementary learners.
Do you understand what I'm saying there?
Not exactly.
So if they're not recommending that we have possible metrics to mitigate mask wearing or anything else right now, that we're kind of on our own coming up with numbers, but they're not, we're just on our own with that.
Yeah, we are, and that's been frustrating for some people, but also it's something we asked for for some local control, and don't treat everybody the same, even the same in our region. Our local school districts wanted some control over looking at the local case rates, looking at the outbreaks in the schools, and not having a one-size-fits-all, like everybody's going to start in distance learning. But now some people are frustrated with that, and even one of the local school boards who had a vote about going to masking, we're saying, where is government, basically, to let us know what we should be doing? Well,
it doesn't need to be government, but just somebody who has more knowledge than we do about.
Right. But ultimately, the government's bodies, including the school districts, are the ones who set policy. So it's either the state, the county maybe could, or local. Erie, for instance, could decide we're going to have a local mask mandate, as other cities have done. Not that I see that happening, but I'm just, in other words, it's the policymakers who have to make that decision, and so we have to.
So we can make that decision without the tools to make a good one.
Well, I think there are some metrics, that biweekly case rate. We've got our vaccination rates, and there are some other potential things. We've got our local case rate. We've got what's happening in our schools. So for instance, even going back to that local case rate, we had a local case rate of over 28 in August. We didn't have any cases in our school. We had 0 cases in our school, but the local case rate was over 28 because there were 16, I believe, in, I don't know if you have that up there, Ann. I think there were 16 in a 2-week span in Ely, but it wasn't affecting the school. But, if we had an outbreak in school, that would certainly make a difference. And that's where, I did talk to 2 harbors, and that's their kind of grid that comes off their website is on the back page of your agenda piece. They're really looking at the school outbreak metrics piece of it right now. And they did have kind of the case rate over 10,000s about when they would mask and when they would do other things. They are masking in the elementary right now too. But they're also kind of trying to figure out what would they do to go back. So, yeah, I think it's up to kind of our local government bodies, like our school, to be able to decide what, set policy and what we want to do. So, well, I think we're going to have to continue to look at that and get some guidance. And like Principal Oelke said, what are others? We're all trying to find out what other schools are doing, too, and what they're looking at. I'll be meeting with some local superintendents tomorrow morning, so that's one of my charges, is to kind of find out. I've been talking to a few this week, and that's what I said is our big question is, when are you going to go dial back, and what are you going to use? So that's what we're trying to find out. But and everybody might be a little bit different, but it would be nice to be able to say that what we're looking at too. At the same time, we've got some school districts, one of our neighboring school districts that is in, actually they're in all areas, are they not? Aubrie, Central, St. Louis, Northern, is Southridge included in the Duluth area?
No, that one is in Central. So they're
That's
in Central and North.
So they're in Central and North, and they're not masking at all. So, we certainly get that question. So everybody looks at that data a little bit differently, and they make their decisions based on that too. And I don't think that district right now is looking, or do you know, Aubrie, I'll be speaking with that superintendent tomorrow, but I don't think Mountain Iron has changed either. Have they? They haven't gone to masking, have they?
No, but one of the schools that was kind of really holding to that no mask requirement did suffer increases in cases and did put on a mask mandate, and now are looking at a 2-week reset with people asking, why didn't you do it sooner? So, because now they can't get ahead of that outbreak with the masks on now. Okay. Right, and they cover, like I said, a wide geographic area and lots of different pockets of things too. So that's not one of our St. Louis County schools. That's a different county, but yeah. A different county, yeah. Okay. Neighboring. A neighboring. Okay. Anything else that you think would be helpful for us to look at?
Eric?
Yes.
Tom Omerza.
Hi, Tom.
Hi. I tried talking earlier, but I can't figure out how to use my phone yet.
Okay.
I think the continued communication between superintendents, between school districts, I think is important. Both, you mentioned you're going to talk with a bunch of them, and not only talking with the ones that are mask mandating, but the ones that are mask recommending,
right,
to see what they're looking at. If they're looking at, okay, we're recommending, what's going to tip us into mandating, any kind of, like Ann mentioned too, any kind of help we can get from the local schools would be great from both sides.
That would be nice. And we certainly have an advantage too in that for the most part, most of our younger kids are physically in a different building. We're feeding them in a different building. Unlike some of the those other schools that are K-12 in one building, they might be in different wings, but like some of our other St. Louis County schools that are all in one K-12 building for a lot of them. We have an advantage here too, where I think we might be able to look at, can we look at the Memorial Building being a little bit different than the Washington at some point. But as Aubrie said, most of the schools, Two Harbors is different, but they're also separated into different buildings. They have elementary buildings and they have their high school building. And so their high school building is not masking, but their elementaries are. So, but like Virginia, who just went to, they'll be masking starting Monday on a close, I think, 5-4 vote. For the most part, well, one of their elementaries and high schools is kind of connected in Virginia, but then the other ones aren't. So, but right now they're going, all K-12 masking.
Hey, and Eric?
Yes.
I'd just like to echo a little bit about what Jason said. It'd be nice to get more direction from the people that know more than we do, the health professionals' guidance. It's everybody's doing something different because we're not getting guidance, from school district to school district, and you're seeing different votes and the push to demand information and you're in charge of public health. Help us.
I understand that this is very, very frustrating, and I can tell you at least once a week, we don't want this weight on the schools. We don't. We are sending up to MDH, MDE, to the governor's office for more guidance. Eric's a part of some of those conversations, and here's this going up in multiple ways, and we are asking for thresholds for the schools. Right now, it's not looking like we're going to get much of that relief, but we continue to try and ask for. So we'll continue to fight for that for you guys to take some of this weight off of you.
Okay. Any other thoughts out there right now? Okay, well, if we can kind of summarize then too, I think the administration will talk about vaccination clinic potentially, for the high school, if we can possibly do an event. So we'll look at that and then connect with Essentia and Ely Bloomington Community Hospital. I'll ask our principals to continue to also ask their colleagues on what they're doing for mitigation and looking at masking too in their metrics. And I'll do that with the superintendents and also with some of our local leaders of those institutions like Vermilion Community College, the hospital, Essentia, and some of the other government offices, and see if they also are getting any guidance on what to do. So we'll continue we'd like to revisit this again next week, and hopefully we should have more information for you. And but as we see from the data that we're looking at going up again next week. So right now we're still in that masking protocol, and again, I don't see that switching at least for the next 2 weeks. We have a school board meeting coming up on October 11th, where this masking in general will be on the agenda as an agenda item, and so it'll be addressed again there. I'll give a report out on where we're at too, and hopefully we're able to keep those local case rates low and keep people healthy. So I think a lot of the things that we've been doing have I believe they paid off, and that we've had fewer outbreaks and fewer cases than some of our other schools in the area. So, okay, well, if there isn't anything else, anything, Tim, anything from you?
No.
Jason? Okay. Let's continue to stay in touch, and then we'll be meeting here again next week, and we should have more information for you, and we'll hopefully, again, maybe we can do an exercise in kind of looking at some of those numbers again. I'll put those out there, and we'll hopefully know a little bit more next week. Okay? All right. Thank you, everyone, for joining us this afternoon, and we'll see you next week.
Thank you.
Thanks.